looks at blood flow and activity. It's different than a CAT scan or an MRI. They show what the brain actually physically looks like. This looks at function.
Yes.
And so it's the difference between popping the engine of a car and seeing what the engine actually physically looks like versus SPECT is turning the car on and seeing how it works.
Yes.
And if you have an anatomical problem, this is likely to show it to me. But this is a functional problem. And so here, SPECT basically tells us three things. Good activity, too little, or too much. And then my job is to balance it. And this is looking at the outside surface of the brain. So this view, we're looking up from the bottom. The top is the front part of the brain, the bottom is the back. And what we want is full, even, symmetrical activity. This is from one side, the other side, and this is looking down from the top. And a little bumpy, but the one I'm really worried about is your left temporal lobe and your right temporal lobe are clearly hurt in a pattern consistent with multiple concussions, because the temporal lobe should be full and fat and it looked like somebody pinched them in.
Yes.
And, you know, I always say if I was God's consultant, I would have put bumper guards around the bones in your temporal lobes because they're very sharp. You were never meant to snowboard.
No.
You were never meant to play football. You were never meant to hit soccer balls with your head.
Rich.
And
calling a shout out to my producer over here who's a soccer player.
So it's troubled, and I could see why you were having trouble because there's actually a very interesting part of the temporal lobes called the hippocampus. We should talk about that because the hippocampus is the brain's major mood, memory, and learning center. Every day you make about 700 new stem cell seahorses. So the hippocampus is one of the few areas of the brain that continues to renew itself by the stem cell production. But what's interesting, I just turned 65. My seahorses are not likely to stick around where my 15, almost 16-year-old daughter, hers are.
Yes.
Why? Because it's blood flow. Did you know that neurons, brain cells, don't age? It's our blood vessels that age. So whatever you can do to take care of your vasculature, your blood vessels, that is the secret to anti-aging. Which means it's exercise and not smoking, not drinking much caffeine, not drinking much alcohol, because all of those things decrease blood flow. I'll say the controversial thing everybody asks me, marijuana is not good medicine for your brain.
Oh, man,
right
I'm
now,
so
if you're
glad you're
dying
saying that.
of cancer,
that's different.
Use it to eat.
But if it's Tuesday and you're having an edible because you're just going out with your friends,
it's prematurely aging your brain. Now, so in your scan, bilateral, both sides, temporal lobes not healthy, and you were feeling
100%.
The other image, so here in this one, blue is, actually, I want this one.
There we go.
Blue is average activity. Red and white are the most active parts of the brain. And in a healthy scan for a man your age, the back part is really active and everything else is sort of quiet. But
and remind us, what is the back part? Because this is like the supercomputer.
So the back bottom part of our brain, we have an organ called the cerebellum, which is 10% of the brain's volume, but 50% of the brain's neurons. Half of your neurons are in the cerebellum. So cerebellum is Latin for little brain, but it's way more important than most people think. And most psychiatrists never even think about the cerebellum because they never look at the brain, which has been something I've been trying to change, right? It's one of the missions of my life. I want you to love your brain and look at it. Anyways, your cerebellum...
Don't open up your head, just in case you're wondering.
Your cerebellum is sleepy, but your anxiety centers are up. And if you look here, it almost looks like a diamond. in there. And that can go with past emotional trauma. Now, it doesn't mean it has to, but whenever I see it, I'm like, is there any significant trauma? Now,
I remember we talked. You were asking me all these questions, like before you even showed me this. You were saying, "Now, did something happen in the early days?" And I'm thinking, "Well, I was kicked out of 5 high schools, kicked out of both parents' homes, sure, right?" I mean, but that was 30 years ago.
And it left a lasting imprint.
Exactly.
In your brain. And your basal ganglia, which are here, they're white hot. Mine are too.
Yeah.
These are people who can't stop working.
Yeah.
They're just always,
go.
They go on vacation, they walk on the beach for like 10 minutes. And
then they write a book.
Let's go do something.
Exactly.
Relaxing. And the beautiful thing, and why I'm showing you this is clearly a brain headed for trouble. And your follow-up scan, and so this was 2/12/16, and this is 6 months later, is your cerebellum is so much healthier. This is what a healthy cerebellum looks like, and it's involved in processing and being able to think quickly. And if you're a speaker, you have to do that. People are asking you questions all the time. The top part of the diamond is calmer. The basal ganglia, the anxiety center on the other side's calmer. So we're making progress. And then in the outside, you have better temporal lobe activity, especially here on the left side.
Yeah.
So it's like 6 months, and we're making serious progress.
So I know people are going to want to know how, but I want to, and we're going to cover that, but I want to just acknowledge this too. When I first looked at this and saw basically the front of my brain had flattened, and 6 months later, I'd regained that shape. How is that even possible? First of all, how is that possible? Did I bang my head in the back so hard that my brain actually smushed back into my head?
Right.
It's a frightening thought.
Well, but your brain is in a closed space. So this is why you should never let a child hit a soccer ball with their head. Your brain is in a very hard skull that has multiple sharp, bony ridges. So if I brought my model, you look inside and you're like, oh my God. Because if you damage your brain, you damage your ability to do everything in your life, from being married, which is hard enough with the good brain, to doing well at work, to managing your money, to managing your health. 70% of us in America are overweight. And I published 2 studies that show as your weight goes up, the size and function of your brain goes down. And if we hurt it, it's so hard to make a good decision about food anyways. Now you're much more likely to make a bad decision, which has long-term negative consequences. So before I started imaging, I didn't care about my own brain. It's crazy, right? I was the top neuroscience student in my medical school. And I'd never seen mine. And I didn't know it was really part of the program to get people well. I'm so embarrassed when I say that. But when I scanned myself in 1991, so when I started scanning, I scanned everybody I knew. I scanned my mom, who has a perfect brain, but it fits the quality of her life. She's 88 and has 50 grandchildren, great-grandchildren. She knows everybody's name. She's everybody's best friend. She's the most consistent, reliable, loving human on the planet. And then I scanned mine, and it wasn't good because I played football in high school. And I had meningitis when I was a young soldier, and I had a lot of bad habits. So here I am helping people with psychiatric problems. I don't care at all about my own brain. I'm chubby, I'm not sleeping, I'm eating bad food. I see mine. I develop a concept I call brain envy. I wanted my mother's brain. And I always say Freud was wrong. Penis envy is not the cause of anybody's problems. In 40 years, I've never seen it once. But the thing you really want is a better brain. And so brain health is ultimately 3 things. Brain envy, you got to care about it. Avoid anything that hurts it, you have to know the list, and we've already talked about head trauma and marijuana and alcohol and nicotine and caffeine. Avoid things that hurt it. Do things that help it. You have to know the list.
Yes.
And ultimately, in my new book, The End of Mental Illness, that I'm working on, I came up with a mnemonic called Bright Minds, and it tells you what to avoid and what to do. And so it's, if you want to keep your brain healthy or rescue it, which we did with you, rescue it if it's headed to the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. And we know what they are. And
Give us a few examples. Don't
is the mnemonic, and the B in Bright Minds is for blood flow, right? Low blood flow is number one brain imaging predictor of Alzheimer's disease. It's also seen in ADHD, in depression, and schizophrenia. You don't want to ever do anything that damages your blood vessels. So my grandfather, who I love dearly, had his first heart attack. He developed a major depression a year later, and that's very common because any blood vessel disorder is likely to increase your risk of psychiatric disorders. And I learned that firsthand because I loved him, and it was so sad for me to see. So blood flow. So anything that hurts it, caffeine, nicotine, not exercising, hypertension, as blood pressure goes up, blood flow to the brain goes down.
Hypertension as in stress?
Hypertension is in high blood pressure.
Okay.
And any form of heart disease, heart arrhythmia, heart attack, heart infection, those things. So if you love your brain, you have to love your heart.
Yeah.
And do the right things.
Yeah.
And this is going to sound bizarre, but did you know 40% of 40-year-old men have erectile dysfunction? What's that?
Really?
It's a blood flow problem.
Of course.
70% of 70-year-old men have erectile dysfunction. And so if you love your brain, which means you'll love your heart, your sexual performance will be better.
Yes.
And that's actually one of the things my patients often tell me is my sex life is so much better since I started working with you.
Yeah.
It's about blood flow.
So
So R is retirement and aging. When you stop learning,
Yes.
your brain starts dying.
Yes.
And, you know, I just turned 65. I've seen thousands of 65-year-old and older brains. It's not good news.
No.
But it doesn't have to be bad news.
Yeah.
If you get serious, you can. I have this whole group of 90-year-old men and women that have stunning looking brains. My grandmother was one. I got her brain at 92. It was gorgeous. And her secret was knitting. Because knitting is a cerebellar exercise. Because the cerebellum's involved in coordination, and it's this fine motor coordination.
Like ping pong.
Ping pong is awesome.
Yeah.
And people who play racket sports live longer than everybody else. Did you know that?
I'm not shocked.
And people who played football and soccer live less long than anybody else.
Well, unfortunately, we keep seeing that in the news.
No question.
Yeah.
So R is retirement and age, and you want to make new learning part of everything you do, which is why this podcast is good. Your training programs, what you're doing is you're stretching people's brains and helping them make money, which decreases their stress at the same time. I is inflammation, which is a major cause of depression and dementia. And I did a study on omega-3 fatty acid levels, because when they're low, inflammation goes up. 97% of the population had suboptimal levels of omega-3 fatty acids.
And aren't we just talking about fish oils here?
Fish oil, fish, and not eating processed foods filled with pro-inflammatory foods like corn, soy, wheat, and dairy. And people go, oh, that's everything I eat. Well, there's 10,000 other choices. You know,
Yes.
God gave you a big brain for a reason.
Yes.
Like, try to go around the world and create brain envy. It's like, oh, I love my brain. And I worked with BJ Fogg. Do you know BJ?
No.
He's a really interesting guy. He works at the Stanford Persuasive Tech Lab. And it's about how people change.
Yes.
And so we worked with him for 6 months, and we created 50 tiny habits. So tiny habits is his thing. What is the smallest thing I can do today that will make the biggest difference in your life? And so our number one tiny habit is, before you do anything, before you say anything, before you eat anything, just ask yourself, is this good for my brain or bad for it?
Oh.
And if you can answer that question with love,
Yes.
because doing the
Yes.
right thing is never about you should do it. Because if you think you should do it, you won't do it.
No.
God said you shouldn't go to the tree. The next scene in the book of Genesis, they're at the tree. Now, God said to Adam, what is your goal?
Yeah.
And my goal is for her not to wear clothes.
Yeah.
And she goes, let's go to the tree. It's like, no, it doesn't fit the goals I have for my life. They're
Yes.
you're gonna wear clothes and they're gonna kick us out of the Garden of Eden. Bad idea. But because people don't make decisions
Yeah.
based on their goals,
Yeah.
they make impulsive decisions. But I love sugar. I love
Yeah.
alcohol. I
Or-
love, and
I-
it's like, that's
I
like a bad
need-
relationship.
Yeah, I need is the one I hear all the time. But I just,
Because ultimately you need a healthy brain.
Yes.
Because without it, everything in your life is harder.
Mm-hmm.
And so also under inflammation is the gut-brain connection.
Thank
Because
you.
when your gut is not right, you're more likely to be inflamed because you develop this thing called leaky gut, where stuff gets inside your body that you don't want. And it can cause autoimmune disorders, can cause pain, can cause arthritis. So
Start good
probiotics can be really helpful.
Say
If your gut's not right, you're more likely to have brain fog, you're more likely to be anxious and have trouble sleeping. You have 100 trillion bugs in your gut
Oh, yes.
today.
Yes.
10 times the number of cells in your body. So it's almost like the body is the host for the bugs.
And we're talking parasites right now. Other than
No, there are
parasites?
bacteria, there are
Okay.
viruses,
Okay.
there's some parasites. And you should have about 85% healthy bugs to about 15% of the troublemakers. You know, people have
Yeah.
heard of E. coli.
Yeah.
And so everybody has E. coli in them. It's when you damage the healthy ones. And how do you do that? Well, what does alcohol kill? Bugs. You know, my wife's a nurse, and why does she put alcohol on your skin before she gives you a shot? Because it's killing the bugs.
Yeah.
So drinking a lot of alcohol is murdering a lot of the bugs. Antibiotics. What do antibiotics kill? Bugs.
Yeah.
Pesticides. What do pesticides kill? Bugs. It's like, well, I don't need pesticides. Well, every time you're eating something that's not organic, and some of the times when you are eating organic,
Yeah.
you're ingesting pesticides. Artificial sweeteners like Splenda have been shown to damage the microbiome or the bugs.
Yeah.
So I don't want to hear I can't have any fun.
Yeah.
That means your mindset is screwed up.
I agree.
Because without a healthy brain, nothing in your life is as good as it can be.